So I'm Dr. Sasheela, and I'll be moderating the next session. So it's my pleasure to introduce our distinguished speaker for today's talk, which is Associate Professor Dr. Rukumani Devi Velayuthan. So Dr. Ruku is a lecturer and consultant microbiologist, and she heads the Mycology unit in the Department of Medical Microbiology at the Faculty of Medicine, University Malaya. Well, she did her master's in pathology in UM in 2011, and she brings a wealth of expertise in medical microbiology. She was trained in the WHO Collaborating Center in India and the Mayo Clinic in Rochester, USA, and she brings extensive expertise to her field. She has pioneered rapid, advanced molecular and automated systems for fungal identification at UMMC, focusing on pathogens linked to nosocomial transmission, including Candida auris. When we had our outbreak, she was very helpful. So Associate Professor Ruku is also passionately involved in reading fungal histopathology slides in the mycology unit, in the UMMC mycology unit now is recognized as one of the referral centers for fungal diagnostics in Malaysia. So today she will share with us her valuable insights on her experience with Maldi-TOF in Medical Mycology Laboratory-UMMC. This innovative technology has transformed fungal diagnostics, and Dr. Ruku's expertise will provide us with deeper understanding of its application and impact in clinical settings. So please join me in welcoming Associate Professor Dr. Rukumani Devi Velayuthan. So Dr. Ruku, the floor is yours.
Okay, thank you for the kind introductions. So without further ado, I will start my presentation. Okay, so so this is my topic that you already told. So basically we have, this is the Maldi-TOF machine, that automated system we have in our lab. And this is the YTech2 system. We have it in our lab too. So this is our small mycology lab where all the identifications and sensitivity testings are done. Okay, basically Maldi-TOF is, the machine was in PPUM since 2018. So it is matrix-assisted laser desorption or ionization time of flight spectrometry, which is the abbreviation for this Maldi-TOF. It is actually revolutionized fungal identification technology in clinical microbiology laboratories. And basically it started for bacterial identifications, then fungal identifications in mid-2018, and for molds at the end of the 2018. It is first established in Malaysia as well. So this is the principle of Maldi-TOF. You can see the target plate. Laser beam is in target plate, and the desorptions occur, dissolvations and ionizations occurs. Then the ion which is developed will go into the mass analyzer. Okay. So the identifications, the protein profile of each of the fungal species is unique, and generated mass spectrum is compared to the database of known fungal spectra, and it is identified based on the closest match to the reference spectra in the database. So basically, we used this since 2018 because automated system required as sample was going up quite drastically, and biochemical tests and PCR for sterile site samples are time consuming and very subjective to interpret. Personally, I also have attached myself in WHO Collaborating Center in India, Chandigarh, during my sabbatical leave, and I noted wide use of Maldi really helps a clinician to start the treatment early and to switch to targeted treatment as fast as it could. And also why Maldi is chosen for fungal identifications in UMMC, important role because rapidly and accurately identify the clinical filamentous fungi and yeast-like fungus. And also this has been part of our clinical mycology routine places around the world since 2014 and 2015, but there is no any data has been reported for the accuracy of Maldi usage in Malaysia. So therefore, we decided to set up Maldi for valid mold as well as yeast identifications. And this is FDA approved, so it's very confident for us to release the result. So others, like the role of Maldi in fungal diagnostic are like, for example, what Prof. Sasheela was telling, Candida auris were emerging, it's causing outbreaks around 2017-18. So we need to have some sort of like advanced technology to pick up the new emergence of HIA infections. So basically also helps the also basically phenotypic identifications of filamentous fungi needs skills and training. So it is also operated dependent. So basically we need some sort of like advanced sort of a technology to help us morphology identification till species, so that it can help to further identifications and a treatment for the patient. BSL-3 pathogens are also safely identifiable. Like example, Histoplasma capsulatum was able to be identified to the species level without aerosolic exposure of the spores. So Maldi-TOF and Vitek2 system in UMMC, because solid evidence and reproducibility of the results and visibility of the data for extraction. So, and also storage, interpretation, reporting, troubleshooting for publication and education purpose. So, and also identification and automatic systemization for antifungal susceptibility testing. All these things are important for us to set up some sort of advanced technology in this area. Okay, so since 2022, we have completely stopped biochemical tests for the identification of yeast and yeast-like fungus. And QC and preparation of the biochemical tests are also time-consuming actually. Like for example, sugar assimilation tests, urease tests, germ tube tests, all these things are time-consuming. And we realized that a lot of misidentifications also has occurred, most probably, because APIs, these are the biochemical tests, can have a bit of a false positive result and things like that. So duration also has been really shortened, and the workload of MLT have also tremendously reduced. So those days, if you can remember, it takes about 2 days for identifications, additional 2 days for antifungal sensitivity testing, total about 4 days after the pure culture is isolated. The results will only come out. But now within a day, about 15 minutes to like 1 day, a pure colony of fungus, especially the Candida species, can be out for validation within a day. So other valid reasons, basically, this system has been, can be updated regularly with CLSI, latest CLSI guidelines, especially for antifungal susceptibility testing. And all this database has been, usually has been updated, okay? So this is how we identify the moles from the Maldi-TOF technology. You can see, this is RCPA samples. You can see this has been Bacillomyces variotic complex, 99.9%. This is a percentage comes out like this. So it's very, very comfortable for us to validate this result. Okay. And also like another example, like Candida albicans. Okay, you can see once Candida albicans are isolated, okay, and validated by the machine, albicans, and then automatically it goes to the susceptibility information. So it can be automatically interpreted whether these Candida albicans are susceptible for fluconazole or voriconazole or caspofungin. So it's auto-interpreted. So it's quite easy for us to show the result to the clinician so they can start the treatment as fast as possible. Okay. So basically, we did some sort of mini studies to see how good is these machines to incorporate the system into routine diagnostic work. So we sort of wanted to compare to the Maldi superior to the conventional method or vice versa. So basically to improve the workflow and the quality for diagnostic workflow. So basically determine the applicability of Maldi-TOF to identify the clinical significant filamentous fungi. Okay, so we took about 250 mole samples in comparison with slide culture, and sample preparation was done based on the company's orders. So you can see the during the 2 years period, like December 2019 to December 2022. 21, I think. So 250 mole samples were collected, and the sterile and non-sterile specimens with percentage is about 35% from sterile sites and 65% from non-sterile site. So total 250 samples, out of which 2021 for nail scraping, okay, skin scraping about 65, that's about 26%, sterile sites, blood and tissue samples about 35, and hair about 17, and others include BAL, sputum about 8. So we did sort of like we did morphology as well as microscopic sort of comparison. You can see with using the Maldi-TOF, we can specifically identify to the species level Aspergillus niger complex and Aspergillus flavus complex and Aspergillus fumigator 6. Okay, compared to the morphology identification with this conventional method, we can do it to the genus level. Okay, 7, 2, and then some we can identify to the species level, because fumigators are quite easy to identify to the species level by morphology itself. Okay, so running through the other filamentous fungi like Penicillium, Chrysogium, Trichoderma, okay, all these things are highly in hyphomycetes. So some of them we are unable to identify. Most of them can be identified to the species level, but you can see Aerobasidium pullulans, you can identify to the species level. Some of them in morphology also we can able to identify to the species level. Okay, and other filamentous fungi like Fusarium solani complex by Maldi-TOF, no problem, we can identify to the species level. Okay, while we are using the morphology, we can only identify to the genus level, because there is many Fusarium solani complex is called a cryptic species, which enclosed in a complex sort of background. Okay, so other things are dermatitious fungi. These are known as black moles. So you can see some of them are unable to identify because this is the, it consists of melanin. So this is one of the reasons it's quite difficult for Maldi-TOF to identify dermatitious fungi. But you can also identify to the only genus level, even morphology. Okay, but Exophilia dermatitis, we can identify to the species level using Maldi-TOF technology, and also Calvaria havariensis can be identified. Others like mucorales also a bit of a difficult because it sporulate very fast. Okay, so we can identify some Rhizopus Rhizopus microsporus complex, we can identify to the species level. Others, if you're using the morphology, can only identify to the genus level. Okay, but again, you can see dimorphic fungi is really good. Maldi-TOF can identify to the species level, no problem. Okay, while we using the morphology, we can only identify sporotrid Shankai complex to the genus level, but some we can identify to the by the species level. Okay, so these are the other filamentous fungi like dermatophytes. Okay, dermatophytes are like Trichophyton rubrum. Okay, so we can identify Maldi-TOF, using Maldi-TOF can identify to the species level, but we can only do it to the morphology by genus by 3 and also to the species level 7. Okay, so other sort of like dermatophytes like Microsporum canis, you can see it's quite common. Okay, which is associated with cats. Okay, Microsporum canis is 12. We can identify to the species level using Maldi-TOF technology, while we can identify to the species level. It's quite easy for us to morphologically identify this fungal pathogen by looking at morphology itself. Okay, so basically out of 250 unique mole groups, which is, I already told you, dermatophytes, dermatitious fungi, dimorphic fungi, and mucorales, and also dimorphic fungus were tested. And out of 250 isolates, 89 were phenotypically identified, but the remaining, about 10%, were identified as non-sporulating moles. Okay, of these 223 moles, 35 isolates were identified up to the species level phenotypically. That means using microscope. Okay, phenotypic methods. Like, for example, we can identify Microsporum canis, Trichophyton rubrum, Histoplasma capsulatum, Eurobasidium, and Aspergillus fumigatus complex. All we can identify by phenotypical methods. Okay, while Maldi-TOF can identify dermatophytes with 94% accuracy, while dimorphic fungi like Histoplasma capsulatum, Sporotrid Shankai complex, and Caloromyces mandafai up to species level, 100% identification can be done by Maldi-TOF. By in terms of hyaline mole, the successful rate a bit more like varies. Like Aspergillus species about 87%, Fusarium is about 92%, and Aerobasidium is about 100%. So a bit of varies. Okay. While other groups like mucorales, no identifications when the test is repeated. Okay, and also only 3 out of 43% were accurately identified by the species level, which includes Mucor, Rhizomus complex, Rhizopus, Microspores complex, and Rhizopus ariasis. These are the common cause of mucormycosis. So only 3 can identify using the Maldi-TOF technology. Okay, and others, even we have difficulty in identifying dermatitious fungi, which is black moles. About 60% of these isolates were correctly identified to the species level. Okay, so basically, overall inference of the study shows that Maldi-TOF has a rapid and accurate identification tool for clinically important species of filamentous fungi, but has proved Maldi-TOF is useful tool and is superiority over slide culture for diagnosing dermatophytes, dimorphic fungi, and hyalin molds. However, slide culture is still the mainstay method for identifying dermatitis fungi and mucorales due to a few limitations of the Maldi-TOF. Okay, so we will go through the limitation later part of the presentations. So I'm going to go through with you guys the overall sort of a clinical samples summary from the 2020 to 2019. So you can see this is 2019 overall samples. You can see 70% of our samples, 74% are Candida species. Okay, this is identified in through Maldi technology. Okay, you can see dimorphic, we had 2%. We have 16% about molds and others are yeast and yeast-like fungus. Let's see the breakdown of the pathogen. So you can see we still having our bulk is still Candida, and you have 101 Candida species, and others we even had one Auris at this 2019. So these are the breakdown, and you can see these are the breakdown for the molds, and these are the breakdown for the Histoplasma capsulatum and Sporotrix. Okay, let's go through 2020. Again, you can see out of 480 total samples for the year 2020, we still have 81% Candida, and then others are some of them are molds, and these are the yeast and yeast-like fungus. Let's go through the breakdown. So you can see albicans still the top score, and then tropicalis is like scored more 123, followed by albicans and others, glabrata. These are the common one that you can encounter in the clinical specimens. Okay, so 80% are still Candida, and others are like 20% are like molds and yeast and yeast-like fungus. Okay, so 2021 isolates. So we have 614 isolates. So again, 78 to 80% are Candida, and others are molds and dimorphic fungus and yeast-like fungus. These are the breakdown. Breakdown. So we can see year 2022 we have we have Candida albicans 100, Candida tropicalis 105, and you can see yeast-like fungus and also molds. We can identify to the species level with this advanced technology. Okay. Conclusion: Maldi-TOF has tremendously improved the laboratory diagnosis of rheumatis fungi, and it provides prompt and rapid identification. Okay, a fast and precise identification of rheumatis fungi is crucial for timely optimal treatments. So, but again, proved that Maldi-TOF has useful tool for dermatophytes, dimorphic fungus, and hyalin molds, but and also yeast and yeast-like fungus. But however, we still put up some phenotypical method like slide culture for dermatitious fungi, mucorales due to the rapid sporulation. Okay. So basically, why it is difficult for us to identify dermatitious fungi and mucorales, because the differences in the growth period of fungi, protein extraction methods, and the reference spectra methodological, all these things have got some sort of like drawbacks to identify the pathogen. And also new taxonomy should be updated regularly in Maldi software to keep in par with newly named pathogen. Okay, so with this Maldi, with Maldi we have quite a bit of publications. So we published Candida volchana. Okay, it's a new sort of a species which causes catheter-related bloodstream infection. So we published this, and also we, thanks to Maldi as well, we had 4 posters published using this advanced technology. Okay, and this is Maldi Isham Asia. We published about 4 oral poster and 4 poster presentation for representing and Malaysia. So we sort of quite a bit we sort of like published using this technology. Okay, with that, thank you so much. Thanks.
Thank you very much, Ruku. That was a really very interesting talk, and I think it's very important as well what you're doing. So there's one question in the box.
Okay.
I think you've answered it, but never mind. I'll ask it anyway. How fast can Maldi-TOF method identify the fungal organism compared to conventional method based on small local studies?
Okay, okay, if you have a pure culture, within 15 minutes, we can identify. I'm talking about Candida and yeast Candida, mostly yeast and yeast like fungus. If it's molds, you have to have a bit of a preparation. You have a fresh colony and things like that. So molds will take about 4 to 5 days to grow. Okay, so yeast will take about like 48, like 2 days. So that's the timing. So with the culture is pure, then we can identify with Maldi-TOF, we can identify about I'm talking about Candida, about 15 minutes. So the same thing goes to mold as well. About after the preparations, about like about 2 to 3 hours. But again, sometimes we have a lot of difficulty also. We don't have problems with Candida, especially yeast and yeast like um, um, isolates, but we have some problems with molds. I told you, dermatitious fungi and mucorales. All these things sporulate very differently, and you need to have a fresh sample. So these are the time that it takes some time for us to identify the molds. While yeast like Candida is easier for us to identify.
Right. Thanks very much. That really helps. And if you don't mind me asking, how
Yeah,
expensive to do this test?
which
Is it
one? Ah,
to do multiple? Is
how do we do it? Oh,
expensive? And is that why we don't do we do it for all of our specimens now?
yeah, most of the we are doing it because because when we compare the cost, when we do up the biochemical tests and all these things taking a lot of time. So our yeast and yeast life fungus, we send it to Maldi-TOF now. No more the conventional sort of procedure. But molds, again, because I told you we have some difficulties, so we have alternative sort of diagnostic method like PCR. Especially sterile samples, we make sure that we do PCR to give you guys the identifications.
Thanks very much. So I think if there's no other questions, thank you very much, Dr. Ruku. I think we all appreciate. I think there's one more question. Thank you for. Is there any misidentification of fungal happening using Maldi-TOF, and what are the possible factors may cause this?
Yes, miscalculations is definitely everything. Every machine has got their all falls back, but that's why we always have these phenotypical methods like backup sort of things. So we will always compare because the percentage, like we say, 99.9% is quite a comfortable zone for you to validate the result, and it's FDA approved machine. So we always compare with the phenotypical method as well as this Maldi-TOF method, so that so that also with PCR, in case there is a discrepancy in a 3 method, so we'll also fall back. So we have like 3 things to fall back. Just don't report it blindly, especially sterile samples. We are very cautious about that. Yeah.
Thanks very much, Dr. Rupu. So if there's no other questions, I thank you very much for that very insightful talk. And I thank all the participants for staying back and listening as well. Thanks, Rupu. Bye.
Thank you.